Our daughter Ellen was 5 weeks old when she was admitted to the Children's Hospital of Richmond at VCU with RSV, which is a respiratory infection.
So when Ellen was 5 weeks old, she developed some breathing problems, and I took her to a pediatrician to figure out what was going on because I was a little concerned because she also had this cough. And they discovered that she had RSV, and they wanted to admit her to the hospital immediately. And I was not going to have her sent anywhere else except to the Children's Hospital of Richmond down at VCU Medical Center because A, I work there and it's the best place to be, and B, I knew that she'd get the highest quality care and the best pediatric services.
And I remember coming home that day, and she had been kind of coughing for a few days before that, and we didn't really think too much of it, but I can remember coming home that day, and Jennifer was holding her, and she could barely, she was just really struggling to breathe, and I think we both knew that we needed to do something about it.
CHOR transport, critical care transport, came and picked us up and transported us via ambulance down to the emergency room where they were waiting for us. They knew we were coming, and we were taken back to the pediatric emergency room where the pulmonologist was waiting and the nurses were waiting, and it was just like a herd that came in and started taking care of her immediately. I'm a nurse, but still having a 5-year-old or 5-week-old who was that sick was a little scary. But it was nice to know that I was at home and that everyone around Ellen knew exactly what they were doing and how they were going to take care of her. So I knew that we were in the right place. Ellen was in the hospital for a total of 6 nights, and she was on the pediatric progressive care unit for a night, and then she was transferred to the acute pediatric unit where she was taken care of for 5 nights. It was a long week. I only left to come home for about 2 hours a day to shower, kiss my boys, and then go back to the hospital to be at her bedside. So sometimes when I didn't have visitors or family there, it got to be long, but I developed some great relationships with the CHOR staff, the nurses, and then Child Life Therapy. Even though she's just 5 weeks old, they would come in and check on Ellen. They brought her onesies. Since she was an emergency room visit, I wasn't prepared for any type of clothing for her. So they gave me some little pink onesies to put her in and dress her in, made it a little homey and personal. And they offered us lunch. Sometimes it's hard. I didn't want to leave her to go downstairs and get anything to eat. So Child Life did offer lunch pizza one day, which was definitely appreciated.
It was, it was a really scary time, right, for us with a little 5-week-old baby laying in a hospital bed with oxygen all hooked up to her. And of course we were really ready to get home and get out of there. But I think one of the kind of cool things that I noticed with Dr. Lee in particular was there was no rush to send her home. They were making sure that she was getting her oxygen levels up and she was in perfect shape to go home. There was no rushing us out the door, which a lot of times, you're in the hospital, you feel like they're just ready to get you out of there and get you home and get on to the next patient. So for me, that was something that was really kind of neat to see.
And I also got a call from Dr. Lee a couple days after we'd been discharged. He called here just to check on her. So the continuity of care and his compassion was totally evident. Ellen is 8 months old. She is a little cherub. She smiles when she wants to, but she's very serious. The only type of care that she needs now, sometimes she'll get a little wheezy, and we have to give her a saline nebulizer treatment every now and then. But otherwise, she's doing great. She's put on her weight. She's just what you expect for an 8-month-old. She's bouncing in her exerciser. She's up on all fours, ready to crawl any day. And she is trying to keep up with her 2 older brothers.